Hello, everyone. On behalf of the GS Clinic Education team, I'd like to welcome you to this tutorial, which will be about the surgical anatomy of the breast. With you today, I'm Gayet Al Abbasi, a final medical undergraduate and an affiliate in the Royal College of Surgeons. Well, as the name suggests, today we're going to talk about and stress on some very important points that are essential for the exam. This is number one. And number two, help you how to understand the clinical part of this tutorial, which will be explained later. The breast is as if we are talking about the external structure. Well, it is this protruded structure in the anterior chest wall, which would be located in the between the area of the second rib to the sixth rib inferiorly, lateral to the sternum medially, and to the mid-axillary line laterally. Basically, there is the nipple, which is the opening of the breast, surrounded by a colored area, which is called the areola, where there is some glands, which is called Montgomery glands. Structurally talking about the breast, well, actually the breast is a huge subcutaneous tissue embedded with connective tissue in the anterior chest wall. Basically, it consists of a lactiferous gland, which secrete the milk, goes more into a lactiferous main lactiferous duct, and this duct ends with a dilatation that's called the sinus or the ampulla, where it's separatedly end in the nipple. There is around 15 to 20 lobes contained the lactiferous gland in the mature breast. Also, there is fatty tissue embedded here, and there is what's called a Cooper's ligament or suspensory ligament of the breast. This is the Cooper ligament of the suspensory ligament. It's of quite importance giving the breast. It is shape and it is structure. Now, what is the breast per se? Structurally talking, the breast is a specialized accessory gland of the skin, and it is of very high importance to secrete milk. This is the function of the breast. Well, there is something that is important to mention, that the breast is composed of four quadrants. There is what's called the outer lateral quadrant, the outer lower quadrant, and there is what's called the upper medial and the lower medial. And there is what's called axillary tail, or also it's called like the brass tail, or sometimes it's called suspensor suspensor tail. And what is the importance of that tail? Well, basically this is an extension of a breast tissue, and basically the specifically talking, the outer upper lateral quadrant may escape through what's called Langer's foramen, which is deep in the fascia here, not present in all of the people, but present in some. And this leads to the extension of the breast into the axilla. Is it of a clinical importance? Well, basically, this is a normal anatomical variation, but this is the axillary tail. It's important to understand that this is a breast tissue. And sometimes it got engorged because this is a breast tissue in some condition. So it could be mistaken for some diseases, and the woman or the patient might feel that this is a problem or a disease. So we should suspect axillary breast tail in those conditions. Well, other differential diagnosis could be lipoma. This is very likely, but never to forget or miss the axillary tail, which is a normal finding and need not treatment, just reassurance. Now, how does the breast develop? Is it the same? No, it's in both sexes. Yes, there is a breast, but it's not the same. Is it the same in the same woman? No, it differs according to the age, and this development is mainly due to the hormonal effect. Well, starting from the early childhood or the late childhood, the breast starts as that of the male. It is rudimentary. There is no that lactiferous duct in it. Lactiferous gland is not that present. On an increasing in age, reaching to the puberty, the breasts start to take its hemispherical shape and extending from the second to the sixth rib. And this is the hemispherical base of the breast. Well, later on, it will have to increase in the size, start to become more spherical in shape because of the hormonal effect of the ovaries that tend to play its role on the breast to increase the lactiferous duct, which will be about 15 to 20 lob in that breast. Well, later on, you can see the shape, the size of the breast change over the age, and this is because of the hormonal effect. What's here? Well, this is the same development that we were talking about, but from this to here, there is some condition later after the puberty or after being adult. Well, in adulthood, like this is in the puberty, in adulthood, it starts to protrude anteriorly or forward. Here, this is a condition specifically to the pregnancy. Well, in pregnancy, the breast size will start to increase um, very rapidly in the first time of the first period of the pregnancy. Well, in the second half, it starts to increase in size, but in less rapidity than that of the primary period of the pregnancy. And this is because of increase in the lactiferous production of milk, increase in the effect of the hormones in the breast, just to make it prepared to prepare milk for the child just after the pregnancy. And here, the shape and the size of the breast just differ in the period of postmenopause, and this is because also of the decrease in the hormonal activity, increase in the fat deposition in the breast, and the breasts start to become more shrinking in size and start to become pendulous. Well, is that importance? It's not of big importance because this is a physiological changes, but we need to understand the physiological changes to understand if this is a pathological or not. This is the normal development of the breast. Now, the blood supply. Well, to be clear with you, the blood supply going to the breast is of two sources. Well, the primary source is coming from the internal mammary artery, where it gives perforated branches. Those are the perforated branches supplying the breast. While the second source of blood is coming from the axillary artery, which is a continuation of the subclavian, and if it continue, it goes to the brachial artery. From the axillary artery, there are two branches supplying the breast. Well, the first one is the thoracoacromial, and the second one is the long thoracic artery, which is also a branch of the axillary artery, with both supplying the lateral aspect of the breast. Now, the lymph node of the breast, this is a very important topic for today. And basically, the breast is get its lymph drained by two main groups. Well, the first one is the internal mammary, internal thoracic node of the group, which is the medial part of the breast, while the lateral part of the breast is drained by the pectoral group of the axillary lymph nodes. And once we're talking about the lymph drainage of the breast, I know it's two only group, but we need to just focus also on the lymph node of the axilla, because one of the lymphatic drainage of the breast is one group of the axilla, and it's in a quiet relationship in connection with other lymph nodes. So a metastatic disease affecting the lateral part of the breast, which will disseminate or metastasize to the pectoral group, might also metastasize to the lateral group, might also metastasize to the posterior group. So we need to understand them, understand its location in order to understand and give a proper description about the extent of metastasis. And to be clear with you, once there is a metastatic disease in one side of the breast, it could be metastasized in one part of the lymph node of the breast. It could be metastasized to the other part. It could be metastasized to the cervical lymph node. It could be metastasized into the inguinal lymph node, because they are in quiet connection and relationship. Now, those groups of the lymph nodes in the axilla is the pectoral, which is the anterior, which lie in the lower border of the pectoralis major, and giving the lymph drainage of the lateral part of the breast, as well as the superficial anterolateral abdomen above the umbilicus. The second one, which is the posterior in a blue color, in red color, which are responsible for located anterior to the subscapularis muscle, and responsible for the lymph drainage of the posterior of the back, the posterior aspect of the body, down to the level of the iliac crest. We have also the lateral, which are in green color here, and they're responsible for the lymph drainage of the upper limb, except for the anterolateral part. And we have the central, which are in a blue here, and they are embedded within the center of the axilla, within the axillary pad. And those are draining the previously mentioned three groups, which are the pectoral, the posterior, and the lateral. We have also what's called a deltopectoral, which are not presented here, and this is because it's too deep, not anatomically strictly, not strictly speaking in the anatomy of the axilla, but they drain the like the anterolateral part of the upper limb, which was not drained by the lateral. We have also what's called the apical, which is in the apex of the axilla, and it drain the rest of all those groups. Now, there is also another classification once we are talking about the lymph node of the breast, and this goes with the levels. Is it of importance? Yes, because once we are talking about surgery, we are going to talk about the level of lymph node which are going to be dissected, resected, and this depends on the aggressiveness of the surgery. Well, depending on those, it's the same groups, but we're going to depend on other like factor to classify them, And this factor is the pectoralis minor muscle, which is a slit-like muscle. This is the smallest muscle of the anterior chest wall, originated in the third, fourth, and fifth rib, just lateral to the costal cartilage and inserted in the coracoid process of the scapula. So any lymph node below the pectoralis minor, this is within the level 1. Any lymph nodes posterior to the pectoralis minor, this is in a level 2, and any above it is going with the level 3. And this is to be familiar with that terms once we are talking about the clinical part, or once we are talking about the surgical part and types of surgeries. Now, what's this? There are three very important terms once in case we are talking about surgical anatomy. This is the finding here of this breast is like a depression like. And there are three terms for describing this, either puckering, either dimpling, or we are going to talk about like tethering. Once I was a medical student in my early years, this was like a conflict for me. Which term to use once I see this finding? Well, basically, they are all the same, but they differ in the timing of using those terms. So once we are talking about a puckering, mean that it is continuously presented. I mean, once you expose the breast, you will see it. But once we are talking about dimpling, I mean, it's not continuously presented. Once you ask the patient, the woman, to do some movement to contract the muscle of the anterior chest wall, like pushing against the wall, like doing other movements, you will see it. And this is called dimpling. Now, when to tell like this is tethering? We cannot do that unless we palpate. In the previous two, I said we inspect. So those are inspectatory finding, while tethering is not. This is a palpatory finding. So once we palpate, we will see a lump. This lump is like infiltrating into the Cooper's ligament as a metastatic lump. This will lead to like pulling the suspensory or the Cooper's ligament, lead to the finding of this depression. And this is for the description of all of those important three terms and in relation to the suspensory ligament or Cooper's ligament, which we talked about in the previous slides. Now, talking about the breast incisions, well, there are different incisions. Those incisions depend on the type of disease that we are going to treat and the extent of breast tissue that we want to expose. Well, talking about the inframammary incision, this is the inframammary incision. This type of incision has a less infective rate. This is number one. It's hidden, which is good. It's used to visualize the depth of the breast. If we have a pathology deep in the breast, it will be very helpful to expose the depth of the breast and see the tissue in depth. Also, it's helpful to do the breast implant. Well, we have two other incisions, which is called the radial incision and the curvilinear incision. The curvilinear is not that used because it tends to injure the lactiferous duct. However, the radial incision does not do that because it's within the it's parallel to the duct, so it won't cut the duct down. It's used to treat abscess, breast abscess. It's used to treat lump, which could be palpated easily away from the areola. Once the lump is within the areola, attached to the areola, behind the areola, it's better to do a circumareolar incision where it has a high infective episodes and also it tend to have difficulty with breastfeeding if the mother is on breastfed. Other incision that is used for mastectomy, for example, is called an elliptical incision, where we are going to do and draw an ellipse within the scalpel in order to like remove the whole breast and connect those edges together like the fish mouth. Well, the references of the lecture for today was from the Snell Clinical Anatomy by Region, the 12th edition, and Basic Science for the MRCS, the second edition. Well, thank you very much. We are very happy to receive your questions and feedback either here in the comment of the YouTube or in the account and social media presented here. Thank you very much and good luck.